We're continually looking to improve the care that we're providing here. We look for areas of opportunity where we're performing well but could do better. One of those areas we identified last year was around pressure injuries. And pressure injury is when patients are critically ill or debilitated and they can't move in the bed, and they have conditions like diabetes or heart failure where they are more prone to skin breakdown and they don't heal well. When they're lying in bed, the pressure that's exerted on their skin can result in some skin breakdown. If that's not cared for properly, it can get worse. One of the ways they can get skin breakdown is just moving the patient, sliding them in and out of the bed, can cause shear injury and tear. And a small tear, if it's there for long enough and the patient's sick enough, can develop into a big pressure wound.
They're financially very costly for a hospital system. It's very dangerous for patients. You become vulnerable to infections once things open.
When we were looking at things we can do to reduce pressure injuries, we looked at technology as well. And one of those technological advances that we hadn't utilized here was something called AirTap.
It fills with air and it will levitate the patient up off of the surface of the mattress so that you can easily move them around the bed, boost them up.
It almost sounds like an air hockey table.
It's exactly perfect analogy, an air hockey table. So think in an ICU when you have to move a patient that's sedated and paralyzed and on life support. It takes 3 or 4 nurses to lift that patient and move them just to shift them in the bed. Once we implemented this, it's a one nurse activity.
You're not taking as many people off the floor, and especially, in the critical care units, the patients are so sick, and you don't want 4 people in a room, because then if there's something event alarming, you're not able to attend to that.
I told Dr. Nadler that I could work in this ICU for another 10 years because of this device. It's laborious. Our jobs they can be very difficult, and it's hard on your muscles to boost patients, turn and position them the way that they need to be turned and positioned very regularly.
When you have all the life support tubes and IVs on you, there's always a risk that those can become dislodged when we do that activity. So being able to just float the patient up, slide the board under and drop them back down, not only save the manpower, but save risk to the patients. So for patients like Tasha, she spent a long time in our ICU, and her condition is exactly where we would want to use the AirTap. She had a condition where she couldn't move. It was a neurologic condition where her body was essentially paralyzed, and we had to move her a lot.
The handles make it so much easier to pull the patient when you gotta reposition them or even do anything with their backside, dressing changes. It makes it so much easier for the other person to help.
Bed changes,
All of that.
And we've really seen a significant decrease in pressure injuries since this device has come onto our units.
And the families have made comments to us too about wow, that's so nice. So
yeah, we're getting positive feedback all around.
We are very grateful to the Kaleida Health Foundation for purchasing these for all of the ICU beds that we have.
Who knows better what our patients need than the people who are at the bedside? We've heard their voice. This is what they wanted, and we're using that money to fund this device. So absolutely thank you to those who contributed. They see the results of their donation, which they see at the bedside. The more engaged they are, the more they are committed to our success. The more our organization is successful, then that serves our mission of high value care for the patient, serving the health of the community, but also the health of our staff.